So in this video, I'm just going to discuss 5 different questions, and that would be, are test boosters worthwhile? What do I think to 250mg a test as a fair cycle? What do I think to heavy eccentrics? Are they beneficial? How important is your training environment? And what major viewpoints of mine have changed over the years? Well, that's 4. There's another one. When to take a deload. Right, so test boosters, I'll quickly give that a no. I don't think they are worthwhile. I ain't seen any evidence to suggest that they actually work that well in the first place. But even if they did, because it's your own testes that are producing the extra testosterone, the issue that you're going to have is the binding proteins in your body are also going to increase. That kind of offsets it. So your free testosterone levels aren't going to be much higher, and it isn't going to be enough to contribute to like hypertrophy and strength gains. So I think they're generally a waste of money. 250mg a test is a fair cycle. So this question comes up a bit more now. It seems a lot more common than it used to be. It used to always be take 500 mega test as your first cycle. That was the most common kind of advice that you'd get. Now, I can understand the 250 mega test. It gives you a chance to get an idea of how you respond to testosterone. It's very genetic. Everyone responds a little bit differently. You're going to get hyper responders, you're going to get low responders, and you're going to get most people who are kind of in the middle somewhere. Now, I would not recommend it as a fair cycle. In my opinion, the dosing is a little bit too low. I believe that if you're going to run a cycle, you may as well try and maximise the benefit from it while minimising health risk. Any use is going to propose some sort of health risk. But maximising the benefits has also got to be considered, because there's no point really going through shutting your body down and potentially other side effects to gain very little out of it. There's got to be some kind of reward for the risk. And it's just everyone's got a different line in the sand where that is. And for me, 250 mega test, I've got clients, I've seen the blood work of some of the people on 250 mega test, and they're in normal ranges. In one case, it's low end of the range, which is unusual, and it's likely that 250 mega test will take you a little bit out of normal range, but you can't bank on it for sure. If you're doing an extended cycle, so say you decided, right, I'm going to start testosterone and I'm going to stay on for I'm going to stay on for the next year, playing around with dosing, etc. Starting on a really low dose is a good thing, because you've got the time to titrate the dose up and, right, this isn't working really well, let's see how this dose goes, and you're getting to know how it works for you better, and it's a good idea. However, if you're one of the guys who think, right, I'm going to run one 12-week cycle per year, I just want something to give me a boost. Now, it wouldn't be my recommended suggestion, just because there's a chance that you're not going to get a great deal out of it. Whereas if I was going to run a cycle, I'd want to get the maximum benefit that I could. Now, using more testosterone does pose the issue of estrogen control. Some people will need estrogen control on a higher test cycle. However, although adding in extra drugs is never going to be a good thing for your health, there are, like, Arimidex and such are well studied in males, and they're well tolerated as well, and they're often used for extended periods. There's some studies like 12 months of Arimidex use at similar levels to what a bodybuilder powerlifter would use it at. So it doesn't necessarily, I wouldn't be too worried or concerned about having to use an AI for a relatively short duration of time. But again, everyone's got their own line in the sand. Overall though, my opinion would be to use either a higher dose of test, even 400 meg, something around there, or maybe keep your testosterone lower and add in another drug that doesn't aromatize, just to make sure that you're going to get the gains out of it. Except if you're going to stay on for an extended period of time, in which case it makes good sense to me. Now, are heavy eccentrics beneficial? So this question was asked to me by a client of mine who I actually prescribed heavy eccentrics for a short period. I've shied away from them a little bit because I aren't 100% sure that they're going to work really effectively. I've got other strategies that I like to use that I've tried and tested, and I'm confident that will help increase somebody's strength. If someone's paying me to increase the strength, I don't want to use them as guinea pigs particularly. I'll probably try a proper block of heavy eccentrics or two in my own training now that I'm training heavier. just to get kind of a feel for it and whether they are likely to help. And then if I've got someone who's hit a plateau, I'll probably start introducing them then. In theory, from what I've read, the reason that they work is they could potentially increase lateral force transmission. Now, what that means is when you contract a muscle, the force doesn't travel directly down the muscle and straight into the tendon. Most of the force, about 80% or so, is directed laterally. So it's directed across the muscle until it reaches the extracellular matrix, and then it travels down into the tendon. So if your muscle's there and your tendon's there, all the force isn't going in straight into the tendon. It's going across the muscle into the fascia and then down into the tendon. Now, between muscle fibers and the fascia, you've got things called costomeres, and they're essentially what's going to retain the force that you're producing. If you've got more costomeres, more of the connective tissue intramuscularly, more force should eventually reach the tendon. Heavy eccentrics could potentially increase the amount of this connective tissue in your muscle, and that's how they would, in theory, build strength. Like I say, I'm not 100% sure about it, but it's something that I'm definitely interested in and will probably try at some point. And there's a difference as well between overload eccentrics versus slow eccentrics. So if you're a 140 kilo bench presser, doing 110 kilo for 5-second eccentrics is not the same as using 155 kilo for even one rep on the eccentric. You're going to bring the bar down faster on the 155, and with the force velocity relationship kind of shifted when it's an eccentric versus a concentric, there's going to be more mechanical tension with a faster, heavier eccentric than there is by controlling the eccentric with a lighter weight. You're just going to get more mechanical tension, so more stimulus. How important is training environment? So extremely important. I'd argue that training environment is potentially more important than the training program itself. I've been lucky enough to have trained in Leeds with Andy Bolton, some really top guys, Brian Reynolds, Dave Carter, Jim Nuttall. There was a really good group of us, 10, 15 lifters, all lifting internationally, all in a decent position internationally. It was a brilliant set of lifters. And the environment there, there's no way that you wouldn't get stronger training in that environment. No matter how hard you feel like you push yourself in the gym, having those kind of people around you who'll pick up on technique issues, or you're just in the vibe of the atmosphere, where one major thing that I learned is lifting with intent. So someone like Andy never used to push his deadlift very heavy. But if he's doing it, bear in mind, he's a 457, 460 kilo deadlifter. If there was 290 kilo on the bar, he's approaching that weight as if it's the 460 kilo. He's aggressive. He's going to move it as fast as he can. He's amped up for the set. It's not a light, easy set. It's a light, hard effort set. And that was kind of ingrained in me. And it makes sense as well on a scientific level, because you're going to get more motor unit recruitment, you're going to recruit more of the muscle, which means you're going to train more of the muscle and get more of an adaptation from it. That was massive. Just the intent everyone used to lift every weight, whether that was X amount of weight on the bar or 1 rep max. Everything was just lifted with intent, and it was a pretty brutal atmosphere, to be honest. If you couldn't handle criticism, it weren't the place to be. So yeah, and another example of that would be somewhere like Westside Barbell. If you look at their methods, yeah, it was a great program for equipped lifting. However, there's arguably better, or programs that are at least as good, but because of the atmosphere there, it really pushed all those guys on to hitting big numbers. And that's just it's the atmosphere. If you're training somewhere and there's not a lot of atmosphere, and it's a bit bland, and you're not going to gain as well. I've got a group down at the gym that I work out of, the Peak Powerlifting group, and those guys, when they're training together, there's a buzz about the place, and they're going to get stronger just from being around that atmosphere. So if you live anywhere near the Hull area, have a word with Peak Physique, try and get down on a Tuesday night, I think the train, be beneficial for you. Now, what major viewpoints have changed for me over the years? So one of the big ones is the application of progressive overload. So it's not that I don't, obviously I believe massively in progressive overload. That's how you gain strength. You've got to progressively overload if you want to get stronger. It's the manner in which I'd implement it now. So let's take an exercise like a dumbbell lat raise. So you're doing dumbbell lateral or dumbbell side raise. Side delt's a relatively small muscle group compared to a lot of muscles. If you're using 10 kilo dumbbells and you're doing a strict set of 12 and you're hitting failure at that, now you're going to get the stimulus for adaptation, which will be muscle growth. If you're taking advantage of it in between sessions, so you're recovering, you're eating enough, you're going to get that muscle growth there. However, is the amount of muscle growth that you're going to get within 7 days enough? Are you building enough contractile tissue to produce significantly more force needed to get an extra rep or to add a bit of weight to the dumbbells? No, you're not. If you're not used to the exercise, if you're not adapted to it, you're going to be able to get extra reps and weight just from the neural adaptation. You're getting more coordinated at the movement. If it's an exercise that you're well adapted to, you might find that you're getting the same numbers for 2, 3, even 4 weeks in a row before they start to move. The thing is, they've got to move up over time, but don't fall in the trap of having everything's got to be beaten every session. You can do that as a beginner. You can do that with exercises that you're unaccustomed to. But if you've been doing an exercise for an extended period of time, especially those that don't require a lot of skill, you're not building enough actual muscle tissue to lift more weight. You're not significantly stronger. It's not going to show up in the gym necessarily. Even though you are building that extra muscle that will eventually lead to strength gains, you're not going to see it week to week necessarily. And what a lot of people do, they'll end up just tweaking the form a little bit to make it a little bit easier. So they're going to get an extra rep out. They're going to be able to lift a little bit more weight. But that isn't because they're stronger. They're just changing the technique a little bit. They'd have been able to do that the week before. So one of the ways that I like to get around this, because it's not motivating to lift the same weights week in and week out. I don't like to do it, and my clients, I'm sure, wouldn't like to do it. So with exercises like that, I'd be more inclined to set them up over a few weeks. So let's think, right, on the 4th week of dumbbell lateral raise, we want you to be able to be notably stronger than what you were. That's a good sign that you're gaining muscle through your side delts if you're keeping the form the same. So week 1, it might be, I generally take single joint exercises to failure. So it might be dumbbell side raise, 15 rep max, keep at that weight for 2 more sets to failure. The next week, you're going to go in and hit a 12 rep max, and you might drop the weight down a little bit, or you might stick at that weight for another couple of sets to failure. And then on the 3rd week, you might go 10 rep max, and then again, another couple of sets to failure. The rep range can vary there. And then on the 4th week, you're going to go back to the 15 rep max set, and you're going to try and either hit 16, 17 reps, or you're going to try and use a little bit extra weight. And that's a way that you're continuously progressing, because then the following week you're going to hit a new 12 rep max, or you're going to lift your 12 rep max for more reps. So psychologically, you're still pushing forward, you're building momentum, and it's enjoyable. You've got targets to hit. Machine work is another one, just a real quick one. When I started powerlifting, strength training, I was not a big lover of machines. They were for bodybuilders. Powerlifters, free weights are better. It was that kind of mentality, and that a lot of strength athletes have, I think, when in actual fact machines are extremely useful for strength athletes. Of course, you're not going to build skill on the main movements, so you're not going to switch all your main movements out for machines unless maybe you're injured. But what they allow more stability. If you're fatigued and your stability is compromised, your muscle activation is going to be compromised. In turn, the adaptation or the stimulus for adaptation is going to be compromised. So say you're doing a bench press workout and you've hit your heavy sets of bench, you've hit a bench assist, you've hit a 5 count pause bench after for a few sets, you're now tired. Going into an AMRAP set on bench press to help build your chest up is not a good idea from a couple of reasons. One being that you're fatigued and your form's going to break down and you're going to drill bad form. And another one is that your stabilising muscles are probably going to be the weak link, which means your chest isn't going to get the same stimulus as it could have done. So getting around this, if you use, say, a plate-loaded press, one that you find that really hits your chest hard, all you've got to worry about is loading the muscle and pressing it. You don't have to worry about stabilising it, which means that you're going to allow your body, will allow more of the muscle to be activated under fatigue, especially, just because that stability factor. And that means that you can really push that set and get a bigger stimulus for your chest, which building more muscle on your chest is going to allow for more force production in the future, which will in turn help you bench press. So machines are really handy, and I use them a lot with my clients, especially in the latter parts of a session. Or for hypertrophy, especially for hypertrophy, I think they're great. When to take a deload. So the way I usually set it out for clients is I don't like to prescribe specific time frames unless there's a competition coming up. So leading into, if I've got a client who's 6 months away from a competition, I've taken them on, one of the first things that I'm going to do is figure out how do they peak for each lift. Is it the third week their deadlift's shit up, or is it the fourth week? Maybe it's the fifth week, maybe it's the second week. And then going into the comp, you've got a very good idea about when to deload, because there you do need to kind of pre-plan to some extent. But if it's not in the comp phase and I'm trying to figure out where things are, I'd auto-regulate a lot of deloads. And I'd auto-regulate them during a comp phase as well if they're needed. So if someone's super fatigued and I don't want them overreaching, I might say, right, next session is going to be a back-off session, maybe 2 sessions in a row. Not necessarily a deload week. In a lot of cases, I don't do a full deload week because I don't think it's necessary. Now, the reason why is you need to think about why are you taking the deload in the first place. There's going to be a few different reasons. It could be an accumulation of muscle damage, accumulation of joint and connective tissue stress, or for strength athletes, it could be the psychological element. Like if you're doing 4 hard sessions in a week and you're having to get yourself amped up for the top sets, it can just become fatiguing and I'm really struggling to get up for these sets. I feel it's hard to get focused. So the psychological element plays a big role there. So if you psychologically need a break, then it's not necessarily going to be, take it off, right, we'll drop the weights down to 60%. It might be, okay, well, other than that, everything's looking good, so let's switch it up and you're going to do a hypertrophy-based session. We're going to take exercises that aren't as psychologically demanding, maybe exercises that are a bit novel, you haven't done them before, so you don't have to worry about hitting a specific target. We're just going to go out and get a stimulus for hypertrophy in this session, and it's going to be productive, and it's going to drop some of that psychological fatigue at the same time. Now, it could be accumulation of muscle damage. It's been seen in powerlifters when they've looked at studying powerlifters, and they see muscle fibers splitting, and that occurs because some of the muscle fibers become necrotic, they die, they're regenerated. It takes quite a lot of stress for this to happen, but I've seen at least one study where it does in powerlifters. And if you're training heavy and frequently, that muscle damage can just become too much to recover from, and you need to take a deload because of the muscle damage. So in this scenario, what we don't want to do is, we'll change exercises and still hit them hard, because we're wanting the muscle to recover. So it might be, this would be one of the cases where, right, we're going to just go light, we're going to get some blood flowing, drop that muscle fatigue off, let them recover, and then we're going to go back and hit it hard again. And the other one would be joint and connective tissue stress, which it's a massive part of strength training, and I'd generally try to minimize the need for this with the programming. Like I'd try to program it in a way that takes lighter sessions a little bit enough in advance that this stress to the joints and connective tissue doesn't build up too high, because everyone who's had inflamed tendons through their elbows knows how shit it is trying to train and how shit it is trying to get rid of it. That pain stays around for a long time. It affects your squat, it affects your bench, it can affect your deadlift to some extent. So generally the best thing to do is don't get into that situation in the first place. If you do find yourself in it, and you might do, especially if you're competitive, because when you're hitting these peaking cycles for a competition, there's a lot of stress. There's a lot of stress on your joints, which means your joints and connective tissue just need a little bit of time off to recover. So you're talking about minimizing the load as much as anything. Still get some blood flowing. You need that blood because tendons, they don't heal well because they don't get a lot of blood flow. So doing light movements is definitely helpful versus doing nothing at all. I'm not going to do like get the bar off your back, get the bar out your hands. Just do some kind of machine-based work. Give your tendons and joints a rest. Doing this maybe once a year for a few weeks is always going to be a good thing, in my opinion. As you get more experienced and stronger, it might be a case of doing it a couple of times a year, taking a few weeks off, kind of heavy loading, especially through your spine. So lower back is the biggest kind of reference point for me as far as how is my lifter recovering. Lower back gets hit with deadlifts if you're especially strongman, because strongman hits lower back so hard with the different, you're getting the compression from a yoke, you're still doing deadlifts, so you're getting the shear forces, and it can be, for some people, it can be really hard for the lower back to recover from heavy work. Again, not getting into that situation in the first place is the best idea, but it seems to be when your lower back is fatigued, it seems to have a knock-on effect on more of your lifts. So your lower back's really stiff and sore, you go to bench press and your strength's a little bit down. That seems common. And that's basically, I believe, it's the central mechanism. So because the lower back, especially your lower back erectors, they're close to your spinal cord, which means, in my opinion, the body's a bit more protective of that area just because of the proximity to the spinal cord, which means it's just going to reduce your ability to display strength, and that's going to be a central mechanism, so it'll affect all exercises. So I do believe, which would be CNS fatigue, but it's not, it's due to the muscle damage. Where am I going with this one? I don't think I've got anything else. So yeah, just managing lower back stress really. That's one of the big things for me when I program. And it is related to deloads, I suppose. And that's everything that I've got for today. So if you've got any more questions or anything you want me to discuss, please send me them over. I'm more than happy to discuss them. Thank you.